So today we will be discussing about my study, that is a systematic review and meta-analysis of effectiveness of progressive muscle relaxation on blood pressure of patients with hypertension. This is a study which has been conducted by three authors. The first author is myself. So we all know that non-communicable diseases have been in recent past associated with plenty of complications and increased mortality and morbidity. As per the recent statistics, these diseases are linked to mortality of at least more than 40 to 50 million patients per year. Hypertension is also one of the most important diseases to be looked into because it's a silent killer. This is a disease which is not known to be developed in the body until the body starts showing signs and symptoms of adverse pathophysiology and degradation. In future, people being diagnosed with this disease would increase rampantly, and by 2025, about 25% of world's population will be living with hypertension with dependency of lifelong treatment escalated healthcare costs. So it is therefore the requirement of the hour to research upon many complementary and alternative therapies which claim to work for hypertension by reducing blood pressure and develop an evidence base. One such therapy is progressive muscle relaxation, which actually relaxes the body and is said to be bring reduction in blood pressure by actually relaxing the body and decreasing the suffering of the patients of hypertension. In this research, we have considered relaxation techniques which involve systematically tensing and relaxing various muscle sets of the whole body. Hence, in this systematic review and meta-analysis, we have tried to generate the evidence on the effectiveness of progressive muscle relaxation on systolic and diastolic blood pressure of patients with hypertension. The protocol for this meta-analysis was developed and has been registered with Prospero with this respective number. The search strategy is that for progressive muscle relaxation, hypertension, blood pressure, high blood pressure, and relaxation, muscle relaxation, progressive muscle relaxation, Jacobsons muscle relaxation, not pregnant, not gestational, not not pregnancy-induced hypertension. So the eligibilities of these studies is, what are the types of studies that are being considered? Two experimental studies and quasi-experimental research studies with pre-test and post-test control group design in English language, which have been published in peer-reviewed journals between 2008 to 2018. Exclusion criteria is cross-sectional longitudinal studies, ongoing studies, unpublished articles, conference proceedings, case series studies and abstracts, and posters, they will not be taken and they will be excluded. The participants that will be included are adults with mean age of 18 years and above, both male and female, hypertensive systolic BP above 140 and diastolic BP above 90 mmHg with stage 1 and stage 2 hypertension or hypertension along with other associated diseases. Exclusion criteria will be adults with gross medical or surgical illness or psychopathology or pregnant women would be excluded. The types of interventions that will be considered are progressive muscle relaxation in experimental group, control group, which receives other intervention or physical training like walking, jogging, exercise, other interventions like routine nursing care, education, or no intervention. In exclusion criteria of studies with multiple interventions or without control group. The types of outcome measures are reduction in systolic BP, reduction in diastolic BP. So literature search was done. A systematic search for studies was done in the following databases between 2008 to 2018. The search strategy was applied to all the databases. The results were downloaded as BibTeX, that is bibliography and typesetting software, or RIS software format. Mentally, reference management system was used for deduplication and maintaining the references. One reviewer, PhD scholar, that is myself, independently extracted the study data, and then it was checked by the guide and any discrepancies or disagreements were sorted out. The relevant data was extracted as in categories of first author, name, gender, duration of illness, age of participants, sample size, changes in stress level, changes in systolic level, diastolic level, and any missing information was inquired from respective authors. However, in this study, stress levels are not taken into considerations. So, in order to evaluate how well the literature was, a risk of bias assessment was done. The methodological quality of the studies was analyzed by Cochrane risk of bias tool for randomized studies and risk of bias in non-randomized studies of intervention tool for quasi-randomized study. Most of the randomized studies were found to have moderate to low effect of quality, while most of the quasi-experimental studies were found to have low quality. but all the studies were included in meta-analysis. So the figures are: risk of bias for the two experimental studies. There were two experimental studies, two true experimental studies were taken. There was unclear risk of bias. They were of moderate to low quality. The risk of bias across the two experimental studies was low to unclear risk of bias. Risk of bias of individual quasi-experimental studies was seen that there was a serious to critical risk of bias, and studies were of low quality. And risk of bias across quasi-experimental studies of PMR was seen to be 6 quasi-experimental studies. They were seen to be a serious to critical risk of bias. The statistical analysis was done by the Cochrane-Revmans 5 software, which was utilized with the purpose of meta-analyzing the studies. Since the studies were less than 10, the funnel plot was not attempted to find out publication bias. So initially in this case, we have a total of records that were fetched were 1,33,000 and 1,33,033. Duplicates were removed. After the duplicates were removed, these many were left. Further, they were screened. The records were screened and retained after title and abstract screening, and articles were excluded. Full text articles that were taken into consideration were 20, and then for the systematic review, only 8 after full paper extraction was taken into consideration. Characteristics of included studies: total sample size was 393. Most of the studies had sample size of 41 to 60. Most of the studies had age of participants between 40 to 60 years. Majority of the patients enrolled in the studies were females. Most of the studies were conducted over a duration of 3 to 4 weeks. Half of the studies had duration of intervention as 30 minutes or less, while other half had duration of more than 30 minutes. Majority of studies were conducted in the hospital studies setting. Majority of the studies had been conducted in India. Majority of the studies were quasi-experimental. In most of the studies, study group and control group were on antihypertensive medications. All the studies, that is 100% reported outcome measure of systolic BP. 75% studies reported diastolic BP, while stress was the least reported outcome. So effectiveness of progressive muscle relaxation on systolic BP was analyzed using random effects meta-analysis of 6 studies. 7 studies, and it showed decrease in the pooled mean SBP of 8.88 mmHg, and overall it was very highly significant. The forest plot generated is shown here, and we can see that PMR was very effective in decreasing systolic BP of experimental as compared to the control group. When it comes to the diastolic BP, randomized effects meta-analysis was performed for 6 studies, which gave the data. And it was seen that it was also very highly statistically significant. Forest plot has been given, but there was high heterogeneity among the studies. So for this, subgroup analysis was done. Subgroup analysis of systolic BP showed that neither for gender, geographical location, study design, study duration, duration of intervention or setting, there was an effect on the SBP after PMR was given when experimental and control groups were compared. So subgroup analysis could not explain the high level of heterogeneity that was seen for the studies of systolic BP, although the effect showed that it was highly significant. For PMR decreased the blood pressure, that is the systolic blood pressure. When it comes to diastolic BP, subgroup analysis was performed for all the moderator variables, but it was seen that the setting had an influence. So the higher effect was seen in community and lesser effect was seen in hospital. Could it have a bearing on the changes of the diastolic BP or the heterogeneity that we saw? Yes, it could have been. So among all these factors, setting was seen to have a better effect for community, and setting could have influenced or modified the effect of PMR on systolic BP, thus lowering it. But